Okay, good morning, everyone. It's Tuesday, the 2nd of June. I hope everyone's well. I've got quite a few updates to give you this morning. The first one I'm going to give you information about is care homes. I know there's been a lot of talk about that recently. And we've all started our virtual ward rounds. So NHS England wrote to the CCG's General Practice and Community Healthcare Services on the 1st of May, requesting that we sort of take immediate action, which in Barnet we've all done really well, which is fantastic. And what we're doing, I just wanted to remind people what we're doing is in a lot of questions. It's really that consistent weekly check-in. It doesn't necessarily have to be a ward round, so certainly a check-in to review patients identified as a clinical priority for assessment and care, and then developing and delivering those personalised care plans to support those residents. And remember that there is also an LCS in Barnet this year with regards to CMCs as well, so completing those. And then providing sort of clinical pharmacy and medication support to care homes. And the CCG is going to be doing an in-reach model, which has started. And also, I'm sure that a lot of you know that there's a geriatrician line now available, and Charlotte's bulletin on Friday gave you the details of that. I also want to just touch base on the advanced care planning. So patients who have capacity should be centrally involved in planning their care. And there's been a lot of media about this, lots of news articles and things in the news. So we've got to be quite careful when we're doing this. And what we really need to do is the key principle is that each person is an individual whose needs must be taken account of individually as outlined. And there's lots of guidance on the BMA's website and the RCGP. So that's really, really important to have a look at. And then we've also got a template that's coming out for GPs this week, so they can use and complete during their weekly check-ins. We'll be sending details of that as well. And the final thing I wanted to mention about that is when we're doing CMCs and we're thinking about CPR decisions, the Resuscitation Council has some information on the process of treatment, of escalation and planning and resources, because it can be quite challenging. And the final thing I wanted to mention is that Marie Curie, there's an advanced planning coordinator which has been commissioned by NCL CCGs, which is fantastic, really. And that resource is now readily available. And I'm sure there'll be some information out in this bulletin about that. Those nurses will have remote advanced care planning conversations virtually by phone or by video link with patients or GPs even, or nurses, or even family members, and can really support in completing CMCs for us, and then getting them ready for us to finally approve and confirm. So that's really a great thing. So we'll make sure the details of that go out in this Friday's bulletin. The next thing I wanted to just touch on was the webinar this week on Thursday, the 4th of June, between 12:45 and 1:45, and that's the suspected cancer pathway changes. So there's been a lot of rapid changes made in the health services in response to COVID-19, and some of the cancer ones particularly have been reconfigured. So I think really this webinar, sorry, is to give you an update on that. And it's the NCL Cancer Alliance has organised it. And there's quite a few panellists. So there's consultant gastroenterologist from the North Mid, haematologist from the Royal Free, colorectal surgeon from the Whittington, and then gastroenterologist from UCH as well. So it's a really good event, and there's a link that was sent out in Friday's bulletin on that, or in the microsite you can have a look at. The next update I wanted to give you is there's lots of questions about whether antibody testing is available for primary care staff. I was working on this yesterday with Katie Coleman and others in NCL, and as you know, the government has said that every healthcare professional in primary care and secondary care certainly should have access to that. So this will be available hopefully by the end of the week, and we should get further details out in Friday's bulletin, if not earlier. And so what it'll be is voluntary testing for the antibody against the virus that causes COVID-19. And the results will help Public Health England understand the prevalence of the virus in the workforce, and also our own staff as well. So we don't know whether carrying antibodies gives protection for future infections, nor if it's protection and how long it may last. So when people do decide to have the antibody test, what's really important, particularly if we're employers, is that if we're telling a member of our team that even if they're positive, we should still continue to follow the guidance for infection control, PPE and social distancing, because we might not be protected. So there's been questions about what is this antibody test. So it's just a blood test. and it tells you if you've got the IgG antibodies against COVID, and it actually looks at the SARS-CoV-2, which is the virus that causes COVID, as you all know. So it will be available for us in primary care to do to all of our colleagues in the practice, so we'll be able to do our blood tests. So it means that some of the staff might be registered as temporary patients in the practice, and then we can do their blood test. But of course, this is voluntary, this isn't compulsory. Or they can go to their own GP and have it done if they didn't want to have it in the workplace. So later this week, we'll be getting it on TQuest or SunQuest if you're in the other part of the borough, and it will be done through Barnet and they're all free. They send it to HSL, which is their lab. So we'll be doing it as like we would any other normal blood test, and it'll be a yellow top bottle, and we'll send it off with our blood test courier like we would do the normal blood test, and the results will come back to the clinician who does the blood test. So if I did the blood test for one of my member of team, it would come back to me. Then it'll be my responsibility to tell that member of staff the result. Naturally, if they went to their own GP, then the GP would tell them. So just across NCL, either the Roche or Abbott's antibody test is being used, and both of these have been shown to be highly sensitive as well. I've had a question about do we need to register the member of staff as temporary? Yes, you do, to get them on the system. They don't need an NHS number, but they do need to be on the system so you can order the blood test on TQuest. We'll be sending out some information later this week. I'm just finalising the comms at the moment, and we'll get that to you. And effectively, what it will say is if you've got the antibody detected that's consistent with exposure to the disease at some point, probably over 2 weeks ago, so it doesn't mean they're currently infectious. You can get a not detected result, which means that they've got no evidence that they've been infected with the disease. And so what you would say to that member of staff is that, again, if you develop symptoms, you can go onto the government website and get tested. Or if you would like to, we can retest the antibodies in 4 to 6 weeks. The final thing is you might get, or we might see it very rarely, but you can get a result called equivocal. We might have seen that on previous things. And what that means is that the result was difficult to interpret, or there was a lab error or something like that. So you may choose to repeat that result in case that does happen. But as I said, more details will be sent out later this week. The next update I wanted to just give you is just a reminder that Consultant Connect is still out there. We've had about 270 GPs, so about 70% of Barnet GPs download the app. Do give it a go. Dermatology is really proving to be very popular at the moment, and we're getting responses within about an hour or two from consultants during the working hours, which has been fantastic. So really great. So if you spoke to a patient in the morning surgery, you might send a picture that they've sent us on AccuRx, and by lunchtime the results are there, so that's great. The final thing I wanted to just tell you about was a really great course that a friend of mine is running. It's the Royal College of Paediatric Update course, the Royal London Paediatric Update course on the 15th of July. And it's an all-day course aimed at GPs, particularly around how we manage paediatric cases in the times of coronavirus, the ways that we're working. So this is a virtual course that's going to be done. It's not going to be based at a site, but it's a really good course. So we can send details up about that as well. I finished my updates. I'm just going through the chat bar. There's been a couple of questions. I've tried to answer as many as I can, but I think there's a question about which labs. I've said that it'll be HSL lab through Barnet, and yes, you should register staff as temporary on the system, but they don't need an NHS number. If there's any other questions, pop them in the chat bar or feel free to speak. Tal, you've got your hand up. I don't know if I've answered your question.
A quick question, just in terms of Consultant Connect and the use specifically of dermatology, do you call them first of all to initiate the call, or
No.
Is there a different pathway?
Sure, so absolutely happy to answer that. So for most of the specialists like cardiology, gynae and things like that, you would pick up your phone, type in their NHS number, and you'd press go and you would ring the consultant. For dermatology, or for example, if you wanted to send an ECG, a picture of an ECG or an echo report, for example, you would do that through the web browser, through your desktop. So you'd go onto consultantconnect.org.uk, and then you would log in with the same login details you register on the app, and then you would pop the NHS number in of the patient, and then upload your picture through that, and then they would respond to you with a written response. So if it's sort of as telederm, for example, they'd respond with a written response. It would say, for example, I think this is a BCC refer or something like that. Is that all right, Tal?
Yes, thank you. That's very clear. Thanks.
And Musa said he did one yesterday, got a response in 2 hours, which is great. Leora's asked a question about something that Arma said on our chat this morning about 2-week weights being removed. So I'll have a look into that later on today. I think what the question is there is that when we make 2-week weight referrals online, most of the providers are saying deferred to provider, whereas I think Barnet is allowing you to book a slot. I think historically that's how it used to work. The slot doesn't mean that it does say the patient is not getting an appointment at this time. It just is a sort of like a dummy slot. It means that the patient will be called within 72 hours of that slot. And historically that's always been there. So the deferred to provider is something that actually is going to be heading back away, because that's what we shouldn't be having on the slot. There should be a bookable slot within 2 weeks. So I'll have a look into that, and we might need to just clarify that. All right, we've gone over by a minute. Is there any other questions from anyone? Leo has just asked a question about paediatric referrals being rejected. So just to remind everyone that paediatric community clinic is not active at the moment. So you can refer to secondary care paediatrics. If you think you need other paediatric advice, we're being advised at the moment to go to advice and guidance. Or if we think it's a semi-urgent matter, there is a paediatric helpline at Rule Free. When you speak to the consultant, they can book you into a paediatric hub clinic at Barnet or Edgware Community Hospital. So I know that at the moment there is no advice and guidance slot at the Rule Free. There are other hospitals. I think the Rule Free one is quite busy at the moment, so there's no current slots this week. But there is the paediatric hotline, so you can phone the consultant. And this is not for kind of, I need to send a sick kid in. This is for general queries about paediatrics that you think semi-urgent. So, you know, failing to thrive, you think, okay, I need some advice on. I've got a child with really bad, gastroesophageal reflux. What do I do? I've tried ranitidine. Can I go to omeprazole? Those kind of questions. Or child that's had abdominal pain for 5-6 weeks. I think they need an urgent paediatric. If there's any other questions, do let me know. And I will see you all on Friday. Have a great week, guys.
Thank you.
Take care, guys. Bye-bye.
Bye. Have a good day.